Okay, chapter 23 is going to be dealing with angina. And a little side note here is the anaerobic byproduct is lactic acid. Anaerobic, meaning weightlifting or sprinting, decreased oxygen byproduct lactic acid. So some of the things that can help treat angina are nitrates, nitrites, beta blockers, and calcium channel blockers. So beta blockers are going to help by increasing the preload, and nitrates and nitrites are going to help by increasing your heart rate. So with nitrates, you are going to be able to dilate all the blood vessels. This in turn is going to decrease your preload. It also relaxes the smooth muscle. So dilating the blood vessels, making them bigger, actually is getting less blood into the heart, decreased preload, and the relaxation of the smooth muscle. Cool side note, the coronary arteries can dilate if not completely obstructed with the use of nitrates. Contraindications are severe anemia, there's our skinny little person, decreased blood pressure, head injury, and it is not to be used with erectile dysfunction drugs. You should also remove the patch 8 hours a night to prevent tolerance. That's for nitrates, nitrites, night, remove at night. Now we have our nitroglycerin. That one is given sublingual, and the main reason for it is to avoid the first pass effect because most of it gets lost there. You should always keep it in the original container to prevent air or moisture because it makes it not active. The beta blockers are going to decrease your SA node. There's my SA node. Decrease the firing, and it's going to decrease the contractility. If you're decreasing the contractility and decreasing the SA firing node, you will have a decreased heart rate. When you think of contractility, think of inotropic. And if you're decreasing it, it's negative inotropic. It helps to treat angina, myocardial infarction, hypertension, and dysrhythmias. So it suppresses the renin, which equals dilation. Remember, renin leading to angiotensin 2. So beta blockers are going to suppress the renin, equal dilate. One of the problems with beta blockers is that it can mask the symptoms of hypoglycemia. So your patient might have hypoglycemia, but you won't see it. Calcium channel blockers. So the last chapter, they ended in pine. Here they have added diltiazem and verapamil. These are going to increase your oxygen supply, decrease your automaticity, and the conduction. These are used to treat cardiac dysrhythmias, angina, hypertension, and headaches. Some of the contraindications are acute MI, second or third degree block, hypotension. Be careful with grapefruit because it decreases the metabolism of your calcium channel blockers. If you have a systolic blood pressure that is less than 90, you should hold it and call the MD because let's go back to our calcium channel blockers. Smooth relaxation, treatment for hypertension. Oh, because it's going to lower your blood pressure even more. So, and avoid alcohol. And hot environment. The hot environment causes your vessels to dilate, so that would give you even a lower blood pressure.